Dr. Alaa Murabit, thank you very much indeed for talking to us.
No,
now,
thank you so much for
you're
having
the
me.
founder of the Voice of Libyan Women. You've also been chosen by the Secretary General Ban Ki-moon as one of his advocates for the Sustainable Development Goals. And you do what it says on the can. You like to speak on behalf of women. In particular, people such as, the Libyans have, of course, are going through a period of great turmoil in their history. But when we're talking about the health sector and, the kind of opportunities that employment in the health sector can afford for women, just give us an idea of the kind of transformative impact that it can have on women and how it can address the gender imbalance and inequality.
Well, it's interesting because, when I was younger, I had never thought I would get involved on issues of women's rights or women's empowerment. I was raised in a very equal family. I have 10 brothers and sisters, 5 brothers and 5 sisters. And I remind them every day that we outnumber them. It's an important fact, I think. But I never felt as though any of my rights were negated from me. I never felt as though I couldn't voice my opinions. I never felt as though my voice wasn't amplified. And during the revolution, I saw this in practice. I saw a lot of women get actively involved. And one of the greatest areas they did was actually through health. So nurses and doctors in makeshift clinics, or transporting medicines, or helping people at their most, I think, vulnerable. And I think that's something that women bring across the world. If you look at any recent health crisis, it's been carried on the backs of women, usually local women, often many women who are not formally, inducted into the health sector. Particularly, I would put on the top of that list stay-at-home mothers. So if you look at the Ebola crisis in Liberia, it was women who bear the brunt of that. So with the organization and with a lot of the work that we do with women, I found that my role as a medical doctor opened doors. There is a pre-established relationship with medical doctors. There's an ingrained trust, a credibility there that you often don't get for women's rights organizations. And that trust factor, that credibility, I think is something that we need to be able to build on, particularly in places of conflict. And women, we know statistically through empirical research, are those who communities turn to most in conflict, who they trust, who they perceive as not having ulterior motives, who they perceive as being in their best interest, and who have the most to lose, not gain from extended conflict. So it's important, I think, to converge those two dynamics together and say, okay, so if this is a platform and we need health workers, we need people in that space, then why do we not take the people most trusted by that community who have the knowledge, who have the skills? I mean, in Libya, women are 75% of medical school graduates. That's a huge number that hasn't been reached even in the most developed of countries.
Sure. A large part of the arguments that this report is making is that so much of healthcare has to be of the preventative kind, and primary healthcare, something that doesn't necessarily involve a doctor's care. But do you think that's a message that's getting through?
Of course, you know what, I think this report is definitely a first step. I think with the Sustainable Development Goals, we've made it very clear that quality health starts at home. It really does. And it starts with local, health practitioners, not necessarily doctors. People who probably, who often didn't go to medical school, often didn't go to nursing school in the vast majority of the world. So barefoot health practitioners who can go into homes, who can be part of communities, who are at weddings when, women start passing around eye drops saying, this one works for me, you should try it. Saying, no, I don't think they all work equally. So I mean, we need those people in every community, and we need them to be elevated within that community, so that their experience and their voice actually translates. Because we don't want people to have to travel, 6 hours in the dark to try to find a doctor who oftentimes cannot help them or could do something that could have been done at home in 10 minutes.
Dr. Alaa Murabit, thank you very much indeed for talking to us. شكرا جزيلا. نتكلم معك شوي بالعربي. شكرا.
بارك الله فيك.